Hello, my name is Brian Mazzarella. I'm a urologist in Austin, Texas. Thank you for joining my virtual discussion today of my abstract titled Prostatic Urethral Lift Can Reduce Voiding Bladder Pressure as Demonstrated by Penile Cuff Testing. First, my brief disclosure, I am a consultant to NeoTract and Teleflex, who are the makers of UroLift and also sponsored my study. For introduction and objectives, I'd like to start by introducing the two technologies I'll be speaking about today. First is the penile cuff test, which is a minimally invasive urodynamic alternative to look at bladder pressures. It's been well validated in previous literature, and what they've been able to show is that the Pcuff interruption pressure is equivalent to the bladder pressure. The way this test works is that a small cuff, similar to a blood pressure cuff, is wrapped around the penis, and the patient completes an active voiding cycle. During a typical test, the cuff inflates 4 to 5 times and it interrupts the void. What they were able to show in their previous data is that during active voiding, as the bladder contracts and the sphincters are open, there is a continuous column of urine from the bladder through the urethra into the penile urethra. And using the cuff interruption as well as an algorithm, they've been able to show that the interruption pressure is equivalent to the bladder pressure. My hope is that the penile cuff test will help us monitor bladder health potentially in BPH patients. The other technology we'll be talking about is prostatic urethral lift, or UroLift, which is a well-established minimally invasive therapy for BPH. The way this procedure works is that tiny implants are placed into the lateral lobes of the prostate to compress the lateral lobes in the hopes of reestablishing flow through the prostate and relieving obstruction. And so the objective of my study was to reveal, number one, penile cuff urodynamic outcomes after prostatic urethral lift in the hopes that we establish the usefulness of penile cuff testing, and number two, the results of UroLift on bladder pressures. For study design, men with symptomatic BPH and compromised Qmax were enrolled at a single center. 9 patients had properly paired data. Mean age was 57, mean prostate volume was 53 cc's. Selection criteria were intended to be unbiased and reflect a real-world application of prostatic urethral lift. Inclusion and exclusion criteria closely matched that of the LIFT trial. Subjects had BPH data accumulated before and after the procedure, including IPSS, quality of life, Qmax, and cuff interruption pressure, which was plotted on a Newcastle non-invasive Nomogram. All urodynamic results were independently reviewed by a urodynamic expert without any significant changes made. Here are the ultimate results, the first of which is that BPH outcomes were greatly improved after prostatic urethral lift. IPSS showed a reduction in 17 points. Quality of life was reduced by or improved by 3 points. Qmax was improved by 7 milliliters per second. These results were all consistent with the LIFT study and in fact similar to real-world outcomes. Penile cuff testing results had a reduction in centimeters of water for the Pcuff interruption pressure from 158 to 132 on average, corresponding to a 27-point improvement in cuff interruption pressure, or a 16% improvement. This can be compared to previous literature comparing TURP at 4 months post-procedure, a paper by Sigil published in 2007 in the Journal of Urology, showing a 20 to 29% improvement in the cuff interruption pressure. And so this is in keeping with UroLift being a less aggressive option as compared to TURP, which remains the more aggressive and gold standard treatment for BPH. When we look directly at the Newcastle non-invasive Nomogram, all patients were in the obstructed range prior to the procedure. 4 of the 9 patients moved out of the obstructive range, 3 of them moving into the unobstructing range, 1 moving into the low pressure, low flow. You can see that generally all of the patients moved in the direction from upper left in the direction of downward right, indicating improved pressures and improved flow. So, in conclusion, penile cuff pressure measurements indicate that prostatic urethral lift can reduce bladder pressure during voiding. 4 of the 9 patients on the Newcastle non-invasive Nomogram moved out of the obstructing range. And so the minimally invasive penile cuff test in the assessment of isovolumetric bladder pressure may be an important element in BPH evaluation, and it reveals improved bladder pressure post-prostatic urethral lift. Thank you for taking the time to listen. I look forward to any discussion which can occur in the discussion below, and I'll be more than happy to answer any questions.